Okay, Tayson, what do you think of this case?
All right, so we're looking at the posterior foreleg, and I see a lot of edema surrounding, is that the soleus or the gastroc?
Yeah, so we can see that there's certainly looks like fluid, probably some hemorrhage in through here, and maybe some signal there. Let's see if we go through axial images, we start up high, and then we come down a little bit lower, and right there you can see a little tendinous structure. And if we
Yeah.
go down farther, we can see some fluid around that little tendinous structure. And then if we go down farther into the calf, this is that same structure that we've been able to follow from much higher up. We can see some fluid in the joint space, and then maybe a little edema within the gastrocnemius muscle. And then down here, and we can see a lot of fluid around it at this point. So what do you think's going on here?
Some muscle tear of the
Okay.
plant.
And there
Is
we
it
can see the
plantaris?
fluid. And then that's farther down. So, and then what happened when we got farther down, we could no longer see the plantaris tendon. So in the past, this is an older study, the vast majority of the time we thought that this was a plantaris tendon rupture. But about 10 to 15 years ago, a number of studies came out showing that actually it's much more common to have partial tears of the gastrocnemius and or soleus muscles as a cause of hemorrhage into the intramuscular septum here as a cause of tennis leg. And so we thought at this time this was a plantaris tendon rupture, but we never really had any proof of it. But clearly we could see that at one point there was edema within the muscle. So this was probably most likely a partial tear of the gastrocnemius muscle.
Okay.
Okay. Robert, what do you think of this case?
All right, so we're looking at the ankle in a 14-year-old male, and looking anterior to the Achilles tendon. It looks like there's a lot of edema there.
Right.
Yeah.
In through here, in through here. So these are the coronal and the sagittal plane, which we see there. Here are the axial images.
Yeah, it looks similar. There's some edema anterior medial to the Achilles, which itself looks
Yeah.
normal.
So here in the peritoneum, this is on the medial side, right in that area. And this was a distal plantaris tendon tear. The plantaris tendon generally sits right around here on the medial side of the Achilles tendon, and this was actually a distal plantaris tendon tear in this 14-year-old. Okay, Oleg, what did you think of this one?
So we have again edema involving.
Yeah, this looks more like hemorrhage to me.
Oh, okay. So it's yeah, okay, hemorrhage involving like lateral compartment.
Well, actually, this is probably, let me go to the axial images where you can see a little bit better. So this is right in through here.
Okay, so then posterior compartment.
Yeah, so this is posterior here, probably the gastrocnemius, lateral, and the medial gastrocnemius, lateral gastrocnemius.
So lateral head.
Yeah, some edema in it. We're probably a little high for the soleus. If you follow this down, we can follow the plantaris tendon coming down. We can see a lot of hemorrhage into the intramuscular septal area. It's really kind of collecting over here. Looks like hemorrhage. At this point, again, we can still see a little bit of that plantaris tendon coming down, and then we lose it, and then distally we pick up the plantaris tendon again in this particular patient. And this was, again, thought to be plantaris tendon rupture, but in retrospect, again, I think that a lot of this was probably an actual tear, partial tear of the gastrocnemius muscle. Okay, is it Robert? Or is it Robert or Tayson next?
I think it's me.
Okay, go ahead.
I think that low signal band in that center image is probably our plantaris tendons, which looks like there's some increased signal, maybe some discontinuity.
So it looks like, so if we go to the axial images, we can see a lot of inhomogeneous signal intensity and thickening of the tissues here in the intramuscular septum with some fluid collection here on the T2, on the PD fat set images, maybe some edema within the medial head of the gastroc there. And so this is another tennis leg. And first described in 1883 by Powell. It was usually attributed to a rupture of the plantaris tendon. But again, more recently, it's believed that the vast majority of these are actual partial tears of either the gastrocnemius or the soleus muscles.
The two muscles function the same in terms of flexion, extension, flexion. And so they both get injured, the gastroc more commonly than the plantaris tendon, which is actually not that common. We used to think so before MRI that all these injuries were plantaris tendon, and we're chronically fooled by it.
Right.
The gastroc is far more of a function in terms of the leg than the plantaris tendon.
Right. And you can get a compartment syndrome with this. You have a lot of hemorrhage.
That's not common in my experience, but I don't know about yours.
What's not common?
Plantaris tendon causing posterior compartment syndrome.
I don't think it causes compartment syndrome very often, but for years we thought that most of these injuries were plantaris tendon tears, and we tried to follow it carefully, but now we know that the vast majority are muscle tears, not plantaris tendon tears.
The treatment is symptomatic, so we don't pay much attention to either one of those. Immobilization is the best way to treat them.
Great, thank you. Okay, Robert?
All right, so we have a 66-year-old male with right knee and leg pain for 1 month. Let's see. It looks like there's some increased signal within the gastrocnemius muscle belly there, and maybe some fluid anterior to that.
Okay.
And it looks like there's some.
A little bit farther down, we can see this cut.
And there it looks like there's some hematoma interposed between the soleus and gastrocnemius.
Right. And so this was another case, right? And then, John?
Well, I wasn't saying anything. Maybe I'm breathing too hard or something.
Okay. And there we can see the hemorrhage in the intramuscular septal part. And then going up higher, we can actually see some hematoma formation. But in this particular case, this had the same symptoms, but this actually turned out to be deep vein thrombosis. And this is actually a thrombus within the venous system here of the leg. So in older individuals, especially if they haven't had a lot of trauma, remember deep vein thrombosis is on the differential, which is important because obviously this is treated differently and could have more important systemic problems than just a muscle tear. And here's another example of deep vein thrombosis, showing the dilated popliteal vein, and then you can get muscle edema, very similar to what you can see with tennis leg. Okay. Oleg.
Yes. 37-year-old woman with mental retardation, cataract, masses for 5 years.
Okay. And here we can see what look like some masses here associated with the Achilles tendon on both sides, right?
Mm-hmm.
On the physical examination. Here's the MR examination.
Mm-hmm. It's something inherited, I guess.
Okay, so you have dilation, marked dilation of the Achilles tendons on both sides, right?
Both stomachs, yeah. Mm-hmm. It's like looks like a muscle intensity.
Okay. Do you have an idea what this might be?
It's kind of like it's probably the something with cholesterol, xantho.
Yeah. So this is a congenital disease. You get cholesterol in the brain and in other tissues, right? Xanthoma, and so this is
Xanthomatosis, yeah. Xanthomatosis.
clinical xanthomatosis, right?
Okay.
Okay. Alrighty. Tayson.
All right. So looking at the Achilles tendon, looks like it's got fusiform enlargement and increased signal intrasubstance right about the mid substance. Is this a partial tear? Is it another xanthoma? Okay.
This is actually another xanthoma, and you can think about partial tear. You can see where the marker is over it, but this is another patient with xanthomatosis, and you can see this enlargement of the Achilles tendon with this xanthomatous plaque within the middle of the tendon. You can see the marked enlargement of the tendon throughout its course here. Right. Okay, Robert.
All right, so we have some radiographs of a 50-year-old female, and looking at the posterior aspect of the ankle, looks like there's an enlarged structure. I'm assuming it's the Achilles tendon there.
Yeah. And here's the MR scan.
Yeah, it looks incredibly thick and pretty thickened throughout.
Again, a patient with xanthomatosis.
Okay. As far as I remember, you don't have to have a high cholesterol level to get this condition.
I'm not sure, John. We should look that up. That's a good point.
I'm digging into my memory, and people that have xanthomas right around their eyelids, they don't have high cholesterol.
Right, they don't.
So it's the same thing, I think, in these.
Systemic xanthomatosis, I'm not sure. Maybe somebody could look that up when we're going on here. Let's see, who's next? Is Oleg next? Oleg?
Yeah, I can. So we have again thickened bilateral Achilles tendons.
Yeah, and again, this is kind of fusiform, very characteristic of appearance of xanthomatosis.
Mm-hmm.
And this is a patient who has familial hypercholesterolemia, where the cholesterol is enlarged in this one, but I'm not sure it is on the others. All righty, Tayson.
All right, so we have two sagittal views of the ankle, and the Achilles tendon looks thickened with increased intrasubstance signal there.
Right, and we can see some edema within the calcaneus here at the insertion. But this is kind of a very characteristic appearance of this particular lesion. And on the axial images, you can see this is more of a focal deposit within the tendon rather than diffuse abnormality. And this is a patient with gout who can also get bilaterally thickened Achilles tendons with pain, very similar. But gout tends to have this a little bit more focal appearance with these gouty tophi inside the Achilles. Okay, Robert?
Okay, so we have a 29-year-old with Achilles surgery 5 years ago for a tear. Now with pain and swelling, rule out abscess. It looks like there's a lot of increased signal, that distal Achilles tendon that kind of protrudes superficially there. Yeah, it's more along the medial aspect, it looks like.
Some post-operative changes here, but this almost looks like a mass coming out of a very thickened Achilles tendon in this patient who had prior surgery, right?
Correct, yes.
Now, this was also gout. So this is all a gouty tophi that developed in the area where there had been surgery before.
That's great treatment for gout.
Yeah, right. Right. Okay, so that's just some information about tendons of the foot and ankle. Okay, guys, I'm going to quit here so that I can reconstruct this particular lecture, and then you guys can log back in, okay?
Okay.
But anyway, let me see if I can get this to...